So I think it was important to highlight that in the context where we are in the global climate. There's one seat here. Does someone want to come sit here? Come, anybody who's there? Shame to not use that seat. Thank you. Great. I'm sorry that you've had to stand in the back, of course. Look, I think one of the things to understand is where we are in some technology. I think climate change, hospitals of the future, healthcare, technology innovation is going to be the way we redesign that healthcare system to make sure we hit that net zero target in healthcare. And we'll mention some of those ideas as we go forward. What's happened now, of course, we have a new language. Yeah, some of you speak French and German and English, of course, and whatever, but actually there's a new language that's taken hold. I heard yesterday, we were talking earlier, there was a language called Esperanto. I'm not sure anyone's heard about that. It was a new language supposed to take over the whole entire world about 100 years ago, so everyone had to speak the same language. It didn't take off, of course, right? No one knows what Esperanto is anymore. But it was an attempt to redesign the world and have one language. Actually, the language now is technology. It's universal. These words behind you here, or in front of you, did not exist 5 or 10 years ago. They literally only came to being in our mindsets in the last 5 or 6 years and precipitated by COVID. But don't think about one technology, whether it's 5G, blockchain, quantum computing, whether it's chat GPT, AI, deep machine learning, etc. Think about how they converge and they work together. As what we're seeing now is a world of convergence of technologies. How AI is powered by 5G, for example, or indeed XI and robotics go together. They kind of work together. Of all the tech verticals, healthcare is the one that's most relevant to all of these technologies. There's nothing like it. Therefore, the future is really interesting, exciting, how we recreate models using some of these tech and also create a system that's much fairer. I do a lot of work in global health, and actually one of the things that we're struggling with, of course, is issues of workforce planning. And of course, by 2030, this is WHO's own work in 2015, and we're going to be over 14 million health workers short around the world. Actually, that's an underestimate. It's more like 20, 30 million by 2030. So we have a global problem, global shortages. We've had COVID, we've had people burning out, some people leave the profession. It's a difficult situation. Also, costs are going up year on year. GDP for the UK is 8 or 9% for healthcare. NHS budget is 150 billion at the moment, and that will rise. The question is we can't sustain that going forward. No one can. So the question is we need a smarter workforce, smarter way of running healthcare systems, to use the same money, existing resources in a smarter way. That's the only way we're going to accomplish what we're doing. Actually, the population is getting older, more chronic diseases. And the NHS budget, actually, 2/3 of it, according to David Cameron's government a few years ago, 2/3 of the 150 billion budget, goes to manage chronic diseases, the diabetes, the hypertensives, the COPDs, etc. There is a live problem. How do we solve some of those issues? Of course, I was actually in Morocco just 2 days ago at their first EH forum, working with, and actually Tedros gave the first open keynote, looking at how Africa, for example, can facilitate and push back and drive forward and perhaps leapfrog other societies in digital interventions. WHO, of course, has got its own recommendations, got a digital health part to it now to push and drive the healthcare system around the world, helping us using technology to make healthcare more equitable and I guess more accessible. So those are the kind of the back end of the conversation. What does that healthcare system look like in the future? Well, here we are. It's going to be digital. We know that. COVID has showed us we need to be more digital. We're going to be more connected, and we are already, of course. The world is a much smaller place than it was 5 years ago. We're going to be data-driven. You've seen the NHS Federated Data Plan. Palantir have won the bid, unsurprisingly, I would say, but they won the bid, and now they're going to not control, manage the data across the entire health system in England alone for the next 5 to 7 years with a budget of about 400 million. So it's a big deal, right? But data-driven is important to drive that system forward, to make personalised care something that we can achieve, and to ensure that we have precise medicine as that we will describe. They've been integrated, of course, integrated care systems upstairs, having their own conference today, the ICB, trying to figure out what they are and what they're going to do with us as we go forward to help us. And of course, this whole multidisciplinary team that we're going to be working as we go forward. If we look at the hospital in the future, what's it look like? Well, first of all, it needs to be, we always think about the bigger, flashier, brighter hospital as the way forward. Actually, we need to think smaller and smarter. Big is not good, because secondary care is expensive. So whatever we do, we've got to drive care into the community, drive care into people's homes, and take it away from hospitals. I think the future is a smaller hospital that just manages what it needs to manage. Less beds, more efficient. That's what we need. So a smart hospital. This is stuff we did with Vodafone a few years ago. I worked as the ambassador for Vodafone and 5G Connect Health across Europe. And we created a concept, well, let's create a smarter hospital. The other thing that's missing in medicine is the patient journey. In kind of computer language, we use the terms UI, UX, user interface, user experience. I've yet to see someone look at PX, the patient experience across a hospital. And we need to think about that journey. So imagine a journey the hospital has, much smarter, driven by your smart card, data-driven. Patient has their own data on their smartphone, for example. Easy access across. We need to redesign hospitals that are smaller, more efficient, but also improve the patient journey. And we don't do that at the outset, which makes no sense at all to me. So smart hospitals, smaller hospitals, and patient journey to be improved. But we need to drive care into the community, promote wellness, well-being, health. That's where the conversation should be, rather than managing chronic disease or the acute episode, which is expensive and time-consuming and not great for people, right, and patients. So the concept now we're talking about is, this is a little journey of 5G. We looked at, with Vodafone, we looked at my journey as a surgeon. What would it look like in the next few years, powered by 5G or 6G, 7G, whichever you decide you want to go for. 5G, of course, has high speed, up to 3-4 gigabytes per second download, and latency of 0.1 millisecond. That's the key. It's almost instantaneous, so you can do live surgery across the world, etc. And so we looked at my life and what it could look like in the next few years. Yes, I have autonomous car already. I have a Tesla, so that's not a big deal. It drives me from place to place. I haven't got a car park space still after 30 years, sadly. I have that. We have upstairs my team, Medical Realities, go and see them. We create the VR education platform. This is real. This is in Milan. Real-time 5G technology using ultrasound scanning to be able to go straight to the hospital in real time using 5G. That's real, it's happening. We're now seeing people using diagnostics. The smart pill, the camera pill you swallow for your intestines, that's now powered by 5G. So you can constantly bring out images, videos in real time for the doctors. We're seeing that now remotely. Remote operations take place across China using 5G and robotics. You can be in one place of China and operate on somebody else, another part of China, happening already. Now we're seeing, of course, patients being discharged, having connected wearables, data-driven, so that you can now review them. Of course, now we see teleconferencing. So actually, my life already is powered by technology and 5G. It's not a thing of sci-fi. This is actually real and happening as we speak. So that's what we did a couple of years ago with Vodafone, looking at the vision. I talked about the PX, the patient experience. This is the key, of course. It's going to be about prevention, lifestyle changes, improvement in well-being, etc., improve mental health. And yesterday we had a huge mental health show at Giant. Managing chronic diseases, that huge burden of resources taken to manage the diabetics, etc. And of course, it's personalized care and remote monitoring that we all see now to be able to manage our data much more efficiently. If I take it back, they call me a futurist, but these are the futurists I aspire to. Look at the year, 1924. The futurists then talked about the future doctor being on the radio wave or on a monitor, on a mirror. Actually, it's that mirror, or whatever it is, right? What they described 100 years ago was telemedicine. It's taken us as a society 100 years to figure it out. Can you imagine? And only precipitated by COVID. Otherwise, we still wouldn't be doing telemedicine. Crazy. It took a major catastrophe around the world to suddenly say, we can be the future. But of course, now we've seen telemedicine rise and rise and rise. But actually, if we look at telemedicine and platform as we go forward, I mentioned the drive from secondary care to community care, or this is it, the hospital, we call it, the new concept. Bring it to home. Let people manage their health at home. Connect the devices, the Internet of Medical Things, Internet of Things, for example, wearables, technology, telemedicine platforms, apps. Suddenly, that cost burden we had before is suddenly more manageable. And patients are now empowered than ever before. So that's the drive. So the future hospital isn't a hospital. It's a health and care system that will allow us to use resources better, allow people to manage their health mainly at home or at their own expense. What if we take away bricks and mortar entirely? We're obsessed with buildings. Yes, do we need them? What if we have portable systems like this primary care? This is in China, actually. So you can pop in here, see a doctor on telemedicine, have all your biometrics measured, get a diagnosis. You take your smart card, you pop it in here, get your medicine, off you go home. So actually, maybe those are models we think about, portable systems, rather than having buildings that are cost inefficient, expensive, and actually, do we need actually those bricks and mortar? So we've got to think outside the box. We are seeing now reasonably these happen now. This is forward.
This is not a doctor's office. It's Forward, the world's first AI doctor's office. An entirely new approach to healthcare with prevention at its core. With health apps in every category to choose from. Body scan, biometric monitoring, blood testing, genetics, and more. After establishing a baseline of your health, you're able to personalize your care with health apps curated for you. Whether it's weight management, diabetes screening, or everyday care, like a routine blood draw, COVID-19 testing, or kidney and liver health, there's something for everyone. The world's first AI doctor's office. It's Forward.
That's interesting, isn't it? How about that for a concept now? In fact, I think Ford have raised over 100 million for this concept, and they bring those pods out soon in a street near you somewhere. Let's see what happens. Let's see that whole journey of pods, etc. So Ford's an interesting company to look at. One thing is that I often talk about is kind of the philosophy of medicine. And actually, let's go back a few years. We talk about this whole concept of, if you look at Darwin's theory of evolution, it's very much incremental. It's slow change. What he describes, Charles Darwin, is the fact that society and human civilization takes many thousands of years to develop and change, right? We've seen that over millions of years on Earth. And actually, that can be true. We kind of understand the concept of theory of evolution. But Stephen Gould, a professor at Harvard, challenged this. He said, actually, society doesn't happen very slowly. He calls something called disrupted, he calls it a bit of disruption, but punctuated equilibrium. The two words he used. What he describes is a process that we travel as human beings on this planet. Say something changes, and we're trying to veer in a different direction. Something big, like a comet destroying the planet and all the kind of the dinosaurs that existed 65 million years ago. So the question I ask the audience often is, where were you, if you were alive at the time and old enough, on 9/11? Everyone remembers where they were on 9/11. I've yet to meet a single person who can't remember where they were when they saw the plane hit the World Trade Building, right? I remember I was in Rome at the time at a football match, and I remember watching the whole thing unfold in the morning. But where were you on the 30th of November, 2022? Can't remember, right? If I said to you, something more profound happened on the 30th of November 2022 than 9/11 or any other time in history, would you believe me? You wouldn't believe me. There we are. That's going to change our world, right? ChatGPT, large language models, suddenly AI is a thing that's relevant, going to power our healthcare system in the future. I just saw yesterday a posting from Microsoft looking at a patient with chest pain. So literally, a doctor was getting advice from ChatGPT, like you would do a consult. You phone up someone, say you're a registrar on call, you phone up another team and say, what should I do with this patient? And you have a little conversation, right? Like a inter-doctor consult. And the ChatGPT gave him advice as another doctor, for example. So we are seeing now how that could really revolutionize where we are. And that's going to change the world, of course. So yes, so where were you on 3rd November 2022? Clearly nowhere by the sounds of things. But that's kind of where we were. That's kind of the understanding of where we were. Of course, concept, other things that are coming out. I thought I'd share a couple of things with you just randomly. This is going to change us. Someone who's been interested in XR for the last decade, and my company's upstairs, Medical Realities, please go and see them, of course, building the future of XR, holograms, and avatars, and educational resources. We're waiting for the big bad boy of technology to come into the equation, and Apple finally, after many years, said, you know what, we're here. I think it was June, they announced the Vision Pro. Oops, yeah. So this was their new concept, the new glasses, smart glasses or mixed reality device, which is now coming out in March of 2024 to Apple Store near you. So go and queue early. Go and get your device. It costs $3,000, so not for everybody. But hey, things aren't cheap when they first start out. And the iPhone wasn't cheap either, right? So I just thought I'd show you a bit about what we do, the future of training and education, and we work with many hospitals around the world and universities to build AI-powered XR.
Introducing AI-powered XR. Immersive training combining artificial intelligence, virtual reality, 360 CGI environments, and interactive 3D content. Introducing Medical Realities, an extraordinary training platform that signifies a groundbreaking advancement in medical education. Within its extensive content library, you're granted exclusive entry to over 30+ live immersive recordings. Whether it's routine medical procedures or complex surgical operations, you're invited to a front-row experience, all while comfortably wearing your XR headset. Get ready to elevate your medical training like never before. AI-driven simulations. Dive into the future with Judy and a continually expanding roster of patient avatars. New content and characters added monthly. As these avatars share their symptoms, you're thrust into dynamic diagnostic scenarios that evolve based on your past sessions, ensuring ever-refreshing challenges.
Tell me what has brought you here, to the emergency department today.
I came to the emergency department because I'm not feeling well. 3 days ago, I was stung by a bee while I was on the beach. Since then, my hand has become swollen and inflamed. I'm concerned about the reaction and I wanted to get it checked by a doctor.
Okay, I would like to give you a quick assessment.
So you go upstairs, we're upstairs, we've actually put ChatGPT at the back end, so you've got large language models, you can in real time have a conversation in 100 different languages. So that's the power of simulation, CGI training for both undergrad, postgraduate and continuing professional education. A bit about digital surgery. Digital health has been a concept for about a decade. The new concept of digital surgery has come out that's connected using XR to do remote collaboration training, driven by hardcore data to improve outcomes, and of course the use of robots and this concept of remote collaboration. And actually this is a wonderful image that I took from the World Government Summit when I gave a lecture there 3 or 4 years ago in Dubai. And this is our concept of the future operating theatre, forget future hospital. It's about 3D printing, it's about X-rays, MRI images, AI in the back end, data-driven pathways, robotic surgery, autonomous surgery, etc. This is the future that we're looking at as we go forward. And surgery is really pushing hard on some of these technologies, as you've seen. So this is the future of the kind of OR. It's interesting. Can we actually think about sustainability in surgery? So this is the RCS. I was a council member for 5 years, and we now produce this as a way of saying we have a theatre checklist that we use all the time, the WHO checklist to prevent complications, but can we actually use that now to think about a green theatre checklist of all the things that might be relevant? So we introduced this about a year ago. Hopefully hospitals now will take it up as part of the WHO checklist. My colleague Anil Bangu from Birmingham performed the world's first net zero surgical operation. They thought about what they need to do in terms of instruments, appliances, etc., and they created this first concept in the NHS, which I think is the world's first. The NHS should be proud that we're taking their net zero quite seriously. I'm going to just move on from that one and just, last couple of slides really, and talk about the real future, just to really excite you. So Philippe will know this quite well, of course. I work in another company and we're building the world's first healthcare metaverse. What the hell's a metaverse, you might think? You know, Mark Zuckerberg was talking about it a year ago. Actually, metaverse is not just about a VR experience, it's the entire digital economy based on NFTs, it's based on Web3 technologies, data secured by NFTs and blockchain. It's a decentralized platform. Web3 is where we're heading towards, Web2 is where we are now, a centralized platform for the 2D internet. We often call this the 3D internet that we were trying to create. So we're creating all of this in the context of the metaverse. And I thought I'd just show you one worlds we're building. So we're building worlds in Unreal Engine 5.2. And what we've launched already is North Australia, Dubai. We've launched Hong Kong, Sweden, and of course Switzerland. And these are the kind of things you'll be seeing soon. We can actually go in, converse, buy services, use your token or your fiat currency to buy therapies. So we're creating these photoreal images now where you can now converse, and we've launched those worlds already. So do come and join us. And more importantly, come and join us here. That's the world that we've created. We're working with major pharma companies, major hospital chains, to be able to use avatars yourself to get services as in a normal hospital system. That's cool, right? Yeah, my own auditorium, my own university. Come on. So we're having our first conference in here. I've been doing so now when you join me now to have a meeting, you'll be automatically pushed into my metaverse. You create your avatar and you meet me in my metaverse for a meeting. Who cares about face-to-face and telemedicine? So old-fashioned. So yesterday, right? So we do that in December, first time. So we'll be sending out invites to people in that industry of the Web3 and XR technologies to push this as fast as we possibly can. We think it's the Amazon marketplace of healthcare in the future. This is the cardiology unit at Lausanne University. They already perform consultations in their own metaverse, in their own hospital, in our metaverse. Okay, so I'm going to leave you there, guys, because I just thought I'd do a quick intro and share the vision with you about where we're heading towards, what it can look like, a few concepts. Not really